Well, on behalf of the National Genetics Education and Family Support Center, I want to thank you for joining this presentation today. This presentation is titled Genetic Service Considerations for Special Patient Populations, Illiteracy and Low Health Literacy. And this is a presentation that is meant to educate providers about considerations or practice modifications that can be made for the low health literacy or illiterate patient population. I also want to note before I get started with the presentation that this PowerPoint presentation was supported by the Health Resources and Services Administration, HRSA, as part of funding for the National Genetics Education and Family Support Center. So today, as far as an outline goes for the presentation, we're going to talk a little bit about literacy, illiteracy, and health literacy. Then we'll discuss some laws and policies regarding low literacy or illiterate populations. We'll also discuss considerations for healthcare providers in terms of practice modification or tips that can be useful for working with this population. And we'll close things out by talking about some resources for providers. I also want to note that all of the resources discussed today are going to be included in a resource listing at the very end with references so that you can go and view each of those resources individually after you watch this presentation. So first, I'm going to share some statistics and facts about the prevalence and impact of illiteracy in America. And then we'll define literacy, illiteracy, and health literacy. So I wanted to start with some brief facts that help explain the impacts and prevalence of literacy. 36 million adults in the United States cannot read, write, or do basic math above a third grade level. Children whose parents have low literacy levels have a 72% chance of being at the lowest reading levels themselves. Low adult literacy skills results in up to $238 billion in total in total added healthcare costs per year. And this represents between 7 and 17% of all personal healthcare expenditures. To put this in perspective, the cost represents an amount equal to the cost of ensuring every one of the more than 47 million people who lacked healthcare coverage in the United States in 2006. 43% of adults with the lowest levels of literacy live in poverty. And according to the CDC, patients with low health literacy are more likely to visit an emergency room, have more hospital stays, are less likely to follow treatment plans, and have higher mortality rates. So let's define literacy, low literacy, and illiteracy. So literacy is defined as the ability to read and write. Illiteracy is defined as the inability to read or write. And low literacy is different from illiteracy. Individuals with low literacy tend to need more time to read and reread information before they can comprehend it. They may also have trouble with things like filling out forms, finding their way through a metro or subway schedule, and spelling. Now, health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information and the services needed to make appropriate health decisions. Here are some potential reasons for patients' low health literacy. Could be a lack of educational opportunity, so people with a high school education or lower. Potentially this could be due to learning disabilities, limited English proficiency, or even cognitive decline in older adults. And it's important to note that only 12% of adults have proficient health literacy, which means that 9 in 10 adults may lack the skills needed to manage their health and prevent disease. Also, according to the American Medical Association, poor health literacy is defined as a stronger predictor of a person's health than age, income, employment status, education level, and race. Now, I want to discuss some of the activities that could be hindered or negatively impacted by low health literacy or health illiteracy. It may make it difficult to locate providers and services for patients. It can hinder filling out complex health forms. It can also make sharing medical history with providers more difficult. It can impact those who are seeking preventive health. It can also create difficulty in understanding the connection between risky behaviors and health outcomes, and can also make it difficult to manage chronic conditions. So here's a handy little tool that was developed by the University of North Carolina at Chapel Hill. It provides state and county level information on literacy levels in the United States. Green on this map is highest, which is considered quartile 4, and red is the lowest, which is quartile 1. You can use this tool to look at literacy rates in your state, your region, or your county. And again, this will be included in the references list at the end of this presentation and shared with this slide presentation for those interested in visiting this resource. So wanting to talk a little bit about policies that were implemented in relation to literacy or low literacy. Signed in 1991, the National Literacy Act of 1991 aimed to enhance the literacy and basic skills of adults to ensure that all adults in the United States acquire the basic skills necessary to function effectively and achieve the greatest possible opportunity in their work and in their lives, and also to strengthen and coordinate adult literacy programs. The closest thing to protection in the US was the Americans with Disabilities Act. And in regards to illiteracy, this legislation provides for a couple really helpful things. So training of educators to recognize and serve illiterate members of the population in a more effective way, especially in the early grades. This has helped identify students with reading and related problems. Enhancement to the Even Start Family Literacy Program. This expanded eligibility for all children 0 to 7 years old. And also prioritization of support to areas with the greatest need, especially areas with a high concentration of adults without secondary education, areas with few community or financial resources, areas with low per capita income or unemployment or even underemployment. Now, we also wanted to highlight genetic and genomic specific literacy initiatives. And in 2010, the American Public Health Association released a policy statement announcing the importance of health, genetic, and genomic literacy. The policy statement outlined 7 recommendations for APHA members to take in order to promote increased genetic and genomic literacy. In 2017, a study found that limited health literacy was associated with lower genetic knowledge, lower awareness of family health history, greater perceived importance of genetic information, but lower perceived importance of family health history information, and more frequent communication with a doctor about family health history. Also noting that genomic literacy has, in general, not kept pace with genomic advances, the National Human Genome Research Institute, in partnership with the Foundation for the National Institutes of Health, or the FNIH, hosted a strategic visioning meeting for a proposed genomic literacy education and engagement initiative. And people attended from all sorts of diverse communities, including academia, industry, community-based organizations, nonprofits, government, and K through 16 education organizations. There were also white papers developed as part of working groups within the healthcare provider working group and the K through 16 working group, which will be linked in the references as well if you want to take a look at the outcomes of that meeting. Now I'd like to review some of the ways that health literacy can impact the healthcare setting. So in terms of healthcare provider challenges, there are oftentimes words or phrases that are commonly used by healthcare providers that are unfamiliar to patients. In general, providers should make sure to use plain language. Obscure technical terms and unfamiliar or complicated language create increased difficulty for patients to understand what providers are telling them. Earning a patient's trust is important and can be challenging. Some things that providers should consider when earning a patient's trust. When it comes to health or medical issues, patients often have feelings of embarrassment or shame. Some patients will act agreeable, not wanting to argue with their healthcare provider. Patients may see different providers each time, so building and maintaining relationships can help establish trust. And patients may be in denial as to their limitations as well. So just things to keep in mind when you're building trust with those patients or clients of yours. Sometimes patients may not ask questions when things are not clear to them. It's common for providers to recommend or share external resources to patients, such as brochures, articles, or books, family-led and disease support organizations, or even materials only accessible online. Providers should really just consider that some patients may find it difficult to access these resources and be prepared to provide additional support to make sure that any patients are able to access or get a hold of these resources if they don't have the means themselves. Now, here are some specific ways you can modify your approach in order to consider the needs of patients with low health literacy. You want to avoid using jargon, complex terms, or acronyms in your discussions with patients. Again, use plain language. When using visual aids, make sure that they have plain, non-scientific language and images. You can use the teach-back method. So really, you want to make sure it doesn't feel too much like a test, but example might be, how are you going to explain this to your kids when you go home? There's also the example here of the Cancer Risk Education Intervention Tool. It's a computer-based, non-interactive slide presentation designed to educate patients who are at risk of hereditary breast and ovarian cancer about genetics. It's been tailored for women of lower literacy, less well-educated, Spanish speakers, and even those without internet access. There's also the instruction book analogy that you can use to discuss genetics. This would be that you can think of the set of instructions that make you human as a book, and the book would be called your genome. And I've got a screenshot of that over here, but also we'll include the link to that in the references at the end of this presentation. Now, next I want to discuss some tips for healthcare providers to support your work with patients who have low health literacy. It really may be helpful to print this slide out and keep this list on hand. We'd also recommend taking a look at the reference list at the end of this presentation. It includes a number of resources and also organizations that you can utilize for additional support on these topics. So some of these tips identify patients with limited literacy levels. You want to make sure that you understand which of your patients have this need so that you can address that and cater your approach accordingly. Use simple language, short sentences, and make sure that you define technical terms. You can supplement instruction with appropriate materials, videos, models, pictures, etc. You can also ask your patients to explain your instructions, the teach-back method, or even demonstrate the procedure. You can ask questions that begin with how and what rather than closed-ended or yes or no questions. Organizing information so that the most important points stand out and repeat this information. Make sure that you are reflecting the age, cultural, and ethnic and racial diversity of patients that you meet with. For limited English proficiency or LEP patients, you can provide information in their primary language. You can also improve the physical environment by using lots of universal symbols. And one last tip here that we have is offer to help patients complete forms, particularly those who may have difficulty with writing or with literacy. So now we'll look at some resources that were developed to support healthcare providers on this very topic. So here's a list of some resources that healthcare providers can use to reduce the complexity of healthcare, increase patient understanding of health information, and also enhance support for patients of all health literacy levels. So we have the Agency for Healthcare Research and Quality, AHRQ, Health Literacy Universal Precautions Toolkit, and we'll have a link to that at the end of the presentation. We have a referral to local and state family-led organizations or condition-specific support groups. Often these groups can be very helpful in providing you with resources that they use to work with families, patients, individuals within their state or within their region to address this topic of low literacy or low health literacy. You can also talk to your local librarian about resources that may be available to you in your area, and also visual take-home resources for patients are another resource that you can use. If you don't have those on hand and available from your institution or clinic, you can always talk to your local or state family-led organizations or condition-specific support groups, or again, your librarians who may be able to provide you with resources that you can provide to your patients. So newest vital sign, NVS, is a valid and reliable screening tool available in English and Spanish that identifies patients at risk for low health literacy. We have heard that it's easy and quick to administer. It requires just 3 minutes to complete. In clinical settings, this test allows providers to appropriately adapt their communication practices to the patient's health literacy level. The instrument can be used to measure health literacy and evaluate the impact of low health literacy on a variety of outcomes. NVS is based on a nutrition label from an ice cream container. So patients are given the label and asked 6 questions about it. Patients can and should refer to the label while they answer the questions. The questions are asked orally and the responses are recorded by a healthcare provider on a special score sheet which contains the correct answers. Based on the number of correct responses, the healthcare provider can assess the patient's health literacy level. Each correct response gives 1 point. So a score of 0 to 1 suggests a high likelihood, 50% or more of limited literacy. A score of 2 to 3 would mean the possibility of limited literacy. And a score of 4 to 6 is almost always indicative of adequate literacy, according to this tool. So again, wanted to mention another resource from the University of North Carolina at Chapel Hill. They developed some literacy sensitive materials that are examples that are really helpful in demonstrating materials that are specifically developed to be easily read and understood. You can see here on this list that they have examples including health topics such as diabetes, COPD, and cardiovascular health. So really provide good examples of materials that would be easy to read and easily understood by your patients so that you can use those practices when you are developing materials or writing information for your patients in your own practice. Using plain language can also make it sure that your audience is understanding your message the first time that they read it or hear it. Expecting Health has developed these plain language principles to support the development of quality materials that are written in a way that makes them easy for patients to understand. Some essential tips are keep it brief, break down jargon, paint a picture, or include an action. So keeping it brief, sometimes we use too many rules, and as a rule of thumb, we should be simple and direct, use familiar and accessible words, and write in a conversational tone. In terms of breaking down jargon, you want to use common words and break any dense information up into smaller pieces. You want to avoid using abbreviations and spell those out completely, and you can use examples to illustrate more technical or scientific points. In terms of painting a picture, you want to make good use of white space and add visual elements in documents. Things like headers, pictures, icons, or even bulleted lists and graphs help your reader connect and follow along. And in terms of the action, you want to put a call to action or a takeaway message at the beginning of your material and reinforce that throughout to make sure that whatever the call to action is that you'd like to have your patient apply, that they are very clear on what that is and can be reminded to take that action from the resource that you provide them. Before we end things, we really also wanted to highlight some of the not-for-profit organizations that are working to combat literacy, to combat illiteracy. These organizations have educational resources and other programs that could be helpful to refer low literacy or low health literacy patients to for support, information, or resources. I'm just going to read through these really quickly, but these will also be included in the reference list at the end. So Room to Read is a global organization devoted to promoting literacy and girls' education. Reading is Fundamental, a US-based organization that has recognized a national literacy crisis in America and is dedicated to creating a more literate country. The National Center for Families Learning, recognizing that reading and education is a family activity, the National Center for Families Learning is dedicated to engaging not just children, but entire families in creating learning programs that raise literacy levels for everyone. And the World Literacy Foundation is a global organization striving to ensure that every young individual, regardless of where they live, has the opportunity to acquire literacy and reading skills to reach their full potential, succeed at school and beyond. So that brings us to the end of our presentation. I'd like to thank you for taking the time to watch this presentation today. The references for information in this presentation are included in the next slide and also available from the PDF downloadable version of this slide presentation. So we encourage you to take a look at that and download or access those resources, as we think that they'll be very helpful in working with patients who are low literacy or low health literacy or illiterate.